Hello, I'm Jo Flanagan and I'm the CEO of Women's Health Tasmania. Welcome to an episode of She's Out There, a podcast series on women's health. This podcast is good for any woman in Australia, but it's really helpful if you live in Tasmania. There are resources to go with today's podcast available on our website. So I'm sitting here in the work car and we're recording the podcast there because we can't afford a recording studio, but the car does very well. And we're joined by Dr. Ruby Grant, who's a lecturer in sociology at UTAS, and she's here to talk to us about LGBTQ women and sexual and reproductive health.
Hi, thanks for having me.
Oh, you're very welcome, Ruby, and welcome to our salubrious sound studio.
It's very comfortable in here.
Yeah. So this is a bit of an area of expertise for you, isn't it? Sexual and reproductive health and LGBT women.
Yeah, so I actually started my PhD at the University of Tasmania in 2015. And when I started, I was going to just be looking at sexual health for young women generally. How do young women think about what safe sex is? How do they negotiate that? And how do new kinds of technologies like social media impact those kinds of things? But what I found when I started reading a whole bunch of stuff around this was that there's actually not a lot about lesbian, bisexual and queer women in that discussion. And I thought that would be really interesting to find out more about young queer women's sexual and reproductive health.
Okay, well let's start with the basics. Can you explain the words to us? So we've got LGBTQ. Possibly plus, and all of these embrace women. So can you step us through those?
Yeah, so this is why I really love this kind of research and just love talking about this area, just because it's so interesting. Gender and sexuality are really complicated topics, and everybody has their own experiences of what those are in their own life and their own kind of words to describe people's identities. So you're probably familiar with L is for lesbian, so these are women who are attracted to other women. G is for gay, so mostly gay men, but that can also, some women use the term gay to describe their relationships or their sexuality, their attraction to other women as well. The main work that I do focuses on the B and the Q, really, which is the bisexual or queer. So bisexuality is quite a broad area that looks at, I guess maybe a common way of understanding it is being attracted to your own gender and other genders. So a really common thing that we see maybe is being attracted to men and women as well, so both. But more and more people are trying to recognise that gender is a lot more complicated than just being man or woman, male, female. There are people who have diverse gender experiences and expressions. So a lot of people now might refer to bisexuality as being attracted to your own gender and other genders.
Okay. And queer?
So queer has a big, long, complicated history, and there are lots of reasons why many people might not like the term queer, and lots of reasons why some people do actively choose to use it. So you might have heard queer being used as a bad word, as a slur towards, usually towards gay people. And that, definitely was the case for a long time. But a lot of people in the gay community tried to, or have decided to reclaim that word, so to take it back and to use it in a positive way to describe themselves. So it also comes from a kind of area of activism and thought that's trying to break down barriers and binaries around sex and gender. And so to just think about sexuality and gender as being fluid, and I guess it's just that it's complicated. And that's kind of what queer tries to capture. It's the kind of fluid or changing or kind of weird ways of experiencing gender and sexuality.
So what's binary? That's another word?
Yeah. I guess, and I've actually just read a really wonderful book called Life Isn't Binary by Meg John Barker and Alex Ian Tarfey. And a lot of the way we think about the world is in binaries. So we think about, men and women, being homosexual or heterosexual. And so I guess bisexuality too is really kind of straddling that binary of, we assume people are attracted to either their own gender or other genders. But so bisexuality really complicates that because lots of people are attracted to multiple genders. It's not just one or the other, it's both. And often there's a sense that for bisexual people that it's that there are two genders, which we think increasingly isn't necessarily the case. But also that there's like a sense of a 50-50 split, that you are equally attracted to men and women. Or maybe you've had, equal amounts of relationships or sex with men and women. But for a lot of people, it's not like that at all. It's a really, the percentages of how attracted they are to different genders change across their life and in different contexts for different reasons. And their relationships might not reflect that either. But that doesn't make them any more or less bisexual.
Okay. Can I just ask about queer? Because queer, you're saying how it was such a mean word. When I was at school, it was a really mean word. And people have made such an effort to make it their own word and a positive word. But is that like the N word? African Americans use the N word to each other, but it wouldn't be at all appropriate for a white person to use the word. It would be very offensive. So for someone who's not LGBT, is it all right to use queer as a word?
I guess lots of people have different feelings about this. I guess the advice I give to everybody, I do work with healthcare practitioners as well and students that I teach, is that always be guided by the language of the people around you. So if you have a whole bunch of gay and lesbian friends and they're like, I absolutely do not like that word and I don't like to hear it, maybe don't use that word to refer to gay and lesbian people. But, if you have a lot of friends who, they say this is the way that I describe myself, and I'm part of the queer community, maybe that might be a way that in that context it might be appropriate for you to use that word as well. But I guess it's always important to ask and always important to be aware of context or what's going on.
Okay, and I think there's one last one I wanted to ask you about, which is pansexual, which it sounds like a new one. I haven't only came across it recently. I think.
So pansexual is not being attracted to to crockery. It is pansexual. Pan meaning all or multiple, is a different way of understanding bisexuality. I guess it comes under the same kind of umbrella, and a lot of people describe it as being attracted to people regardless of gender. So people might say that, when they fall in love with somebody, gender isn't something that they think about. They fall in love with the person. Aspects of their personality, things like that, is what's attracted to them to that person, and gender isn't something that factors into that. So that means that they can, they might be attracted to a man or a woman or a trans man, trans woman, lots of different kinds of people. So a lot of bisexual people might be happy to use pan as well. But there are different kinds of reasons why people might use different terms.
So I guess I could summarise our conversation by saying it's diverse, isn't it? There's lots of diverse genders and ways of describing it, and but it's important to people, isn't it, that they feel that they're described in a way that feels respectful to them.
Yeah, definitely. Yeah, and I think that's why it's a really interesting and wonderful area. And when people do say that, it's all too complicated, this LGBT alphabet soup, it's getting too complicated. But I think it really captures the wonderful diversity of experiences that there are, and it's really interesting. And I think it's great to try and hear about people's different experiences. And
so that's what you've been doing. You've been doing research this area. Can you tell us a bit about your research?
Yeah, so I've done, I guess my PhD work was where this all started, and I interviewed 15 young women and non-binary people, but mostly women who identify as bisexual or pansexual or queer, about their understandings of their identity and then how that might shape their experiences of sexual health and their access to healthcare in Tasmania.
And what did you learn?
So I learned a lot of things. Some really interesting stuff about why people use certain words. But a real sense, I guess one of my favourite findings from the work was that so for many of these young women, so these were women between the ages of 19 and 26 who'd grown up in Tasmania. A lot of them had talked about, going through school, sex education that we received was not very good. But we did learn a lot about, what safe sex means for men when you're having sex with men. So, you've got to use a condom, maybe have the contraceptive pill, all kinds of things like that. They were very across it. And when I asked them, what do you do to promote or to make sure that, that you're having safe sex? They're like, yes, I always do this. I'm all about it, I'm all across it, I'm getting my regular sexual health checks and everything's good. Then when I said, okay, so what about now with your relationships or the sex you've had with women? How has that been? They were really surprisingly like, oh, I don't know, haven't really thought much about it, never talked about that stuff. And I think that's really interesting. These same people who kind of set themselves up as being very, very knowledgeable, very experienced, very happy, and to be assertive with their sexual partners. With women, they found this really hard to talk about.
So what's going on there, do you think? Like, that women don't feel like there's a need for...
Maybe not so much a need, but there's a sense that, I talk about this thing called sexual scripts. We have... we actually learn how to behave sexually, and there are kinds of messages and almost scripts, like patterns of behaviour that we learn. Maybe we pick them up from movies or from media or the way we see other people relate, and a lot of those are heterosexual. It's very clear cut kind of rules for behaviour that people can follow. And people talk about that a lot. We see it played out in movies, we see it played out on TV. It's something people are very familiar with. But then when it comes, we don't really see those same kind of scripts for relationships between women, and then it can be really hard how this stuff kind of plays out. Like, how do you talk about safe sex with a female partner? Is it necessary? There's a lot of misconceptions and a lot of misunderstanding about how to or whether these kinds of things should happen.
And what would you think is the big safety issue for women having sex with women?
There's a real myths around that women, going back to kind of like the AIDS era, women are, lesbians are immune to various STIs, which is not the case at all. But I think the real safety issues are in around that kind of emotional safety stuff. There's not enough emphasis on healthy relationships between women, and talking about things like consent and making sure that everybody is on board and happy to be doing what they're doing, I think.
Enthusiastic consent.
Yeah, that's
right.
What we
want, isn't it? Yeah.
Because, it was actually really sad. There were quite a few people who said that they were in abusive relationships with other women, maybe even women who were older than them, but because maybe they weren't out to their families, or they, there was a lot of stigma around that relationship, or not even recognising that relationship as a relationship. When things started to maybe get into the sort of, abusive territory, these young women didn't know where to turn to for help, because it was seen, this wasn't something they could even talk about as a relationship, which is really, 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 that was some of the hardest stuff to hear in my research.
Young women, if you're listening to this podcast and you're in this situation, do get in touch with Women's Health Tasmania. We've got staff who are well versed in talking to women about women's health issues, and counselling services available. Did you talk to the women in your research about their experiences of accessing health services?
Yes, a lot.
What did they tell you?
It was a big part of the work to look at how, we talked about how they understand themselves and their identity, how they what they learnt about sex, particularly at school and as young people, and their experiences of negotiating safe sex. But then, okay, so what happens then when, maybe you've got a sexual health issue that you want to talk to a doctor about? What happens then when you go into the doctor's office? And there was some really interesting experiences of particularly biphobia. So you might be familiar with homophobia, which is discrimination against gay and lesbian people. But biphobia is discrimination against bisexual people. There was a lot of misunderstanding and outright stigma from doctors towards young women as bisexual. So a lot of assumptions that if a young woman came into the doctor and said, I've had sex with men and with women, I've had this many partners. There was a real kind of judgment from doctors sometimes, and or a dismissing of their identities on the basis of how many partners that they'd had and the genders of those partners. So those kinds of things made a lot of people uncomfortable, and then quite unlikely to want to go back to those doctors or to go back to the doctor at all, which was a real concern considering some of the issues that, not just sexual health issues, but also mental health needs of this particular group of people.
So did the women give you examples of good practice, what doctors had done that they felt had worked for them?
Yeah, so I guess a lot of people just want, maybe this is regardless of your sexuality, people want doctors who are going to be non-judgmental, who are happy to sit and really listen to your experience, and to be willing to ask questions and to admit that if there's something that they don't know, that they're happy to, they'll look into that for you and they'll work with you together to get to the point that you want to get to. In terms of taking sexual health histories, people really liked it when there was a recognition or that the doctors weren't making assumptions about their identity or their behaviour. So, asking things, same questions to everyone, have you had sex with men, women, both, other genders? Those kinds of things made people really, really happy, particularly if they... So I had quite a few women who were currently in a relationship with a man, and but they had past sexual experiences with women or relationships with women, and being able to disclose that in a way that didn't seem daunting. It was just something that was a regular sexual health history check. That made people feel really comfortable and seen as well, which was great.
Yeah. And did you hear stories where things were missed? Like, did the women have stories for you about encounters with doctors where things had gone wrong?
Yeah. Interestingly, a lot of the stuff where things went wrong actually maybe not always were about their sexuality, but were just about young women's sexuality in general. So, almost like shaming, whether that be very explicitly or, really upfront, or kind of sort of subtly or implicitly, making judgments about their sexual behaviour. So I had one woman say that, she had just gone in for some antibiotics that she needed for whatever it was that she had. She needed antibiotics. And then the doctor said, "Oh, so you're on the pill?" And she said, "Yes, I am. And, I've been on that for years, all good." And the doctor was like, "Yep, so you'll need to keep your legs together." And so those kinds of little things are really horrible. And she was like, I did not go back to that doctor ever again. I've told all my friends that this person is not somebody you should go to. And those kinds of things then made people be like, well, if they weren't happy about me being sexually active as a young woman generally, how are they going to be when I tell them that I'm queer or I'm pansexual? It's just not going to be a good time. So there's a lot of the stuff is some really negative experiences in those kinds of ways. Not so much around just bisexuality. There was just generally a kind of a lack of understanding about it as something that is real. Just like the use of gendered language made people really uncomfortable. So saying like, do you have a boyfriend or do you have a husband is making an assumption about the gender of somebody's partner. Even if the person would say then, yes, I do, because I do at the time, that would then be like, well, but if I did have a partner who was a woman, that might be really uncomfortable for me. So those kinds of things were red flags for people as well.
So how do any LGBT women find the right GP for themselves?
There's a lot of, obviously just sort of trial and error, but there is a lot of resources out there, whether that just be within community. I'm a member of lots of LGBT Facebook groups where people will be sharing. People always share like, hey, does anyone know a good doctor who's, cool with me being a lesbian, or who can provide me with good maybe mental health care as a bisexual woman. And so drawing on those kinds of community resources is really great. But there's also like services like Working It Out have lists of providers that are the community know are good, such as Women's Health Tasmania as well. So those are some, there are some official and then also non-official, I guess, channels to find out who's a good person to go to.
Yeah, that's word of mouth is a very powerful thing, isn't it?
That's right.
Yeah. So do things like, rainbow stickers in health practices, does that help people?
Yeah, definitely. A lot of, lots of research, my own research included, does show that people really like to see those visual indicators of that this is an inclusive service. And the people I talked to said that even if they, for people who are bisexual who are in relationships with men, so even if they seem like they're straight to a lot of people, seeing those kind of indicators, that was something that was really like, oh, that place might get me if I go there, and that's going to be really nice. But it is a really important point to make that that's not enough. Like I've spoken to doctors who work in clinics who, they're like, yep, we do a great job. We've got the poster up on the wall. We've got the sticker on the door, done. But it's actually a lot more than that. People, when they go into those services, yes, they want to see that there's visual indicators that that place is going to be inclusive, but that needs to then follow through in the service that they provide. So going back to those things we were talking about trying not to use really gendered language if a person's not comfortable with that, or not making assumptions or judgments about people's identity or their behaviour. Willing to work with people, ask questions if they're not sure, and that kind of stuff in the interaction with the doctors or other kind of health professionals is really important as well, much more than just having a sticker on the door, really.
We've been learning a lot about the fact that GPs have different areas of interest, and they'll pursue those and develop greater expertise in certain areas. And so I guess, if this is an area that's important to you, it's quite legitimate to look around for the GP who has this as an area of interest. And contacting a service like Working It Out to find out who those doctors might be would be a good strategy.
Yeah, definitely. I know that they have a list of doctors that do, and it is an area that there needs to be more and more research and more support for professionals as well, because we do see some of the training can be lacking. But it's really great to see that there are some doctors all over Tasmania who are doing amazing work trying to improve their work and to help serve the needs of this particular community.
So just recently I've been meeting some older women who are lesbians who've moved here as part of this tree change generation, moving down from the mainland into rural Tasmania. And, that presents particular challenges, lovely things, but also challenges for them. And it's got me thinking about the experience of being in the LGBT community in rural Tasmania. So is that something you've explored?
Yeah, quite a bit. I mean, I myself grew up in a pretty regional area, and so this is a topic that's really close to my heart, I guess. Like growing up in Molesworth, there was a real kind of not homophobic necessarily, but particularly around bisexual people and lesbians, a really anti-lesbian sentiments quite a bit as a young girl, which was really confronting. And I look back on that. I'm not lesbian, but I look back on that and being like, being in that environment would be a really difficult time growing up in that environment. And so those kinds of things do shape the experience for people who've always lived there, but particularly for people moving into areas, maybe if they're coming from big cities. People are often shocked that maybe the same kind of services might not be available. And that's really different throughout Tasmania too. So a lot of the women I interviewed for my research were from Hobart, but I did interview quite a few women from Launceston as well. And the folks in Launceston had they said that there aren't very many services in our local area that would cater to some of these more specialised health needs. And so, some of us have to drive all the way to Hobart to get these services, which is, really full on. But then the people in Hobart were very much like, even here we feel like we can't access the same kinds of stuff that we would, ideally like, specialist gender services like they have in places like Melbourne. So, it's all relative, I guess. But Tasmania as a whole faces these kinds of issues. But as well, it's important to focus too on the positive aspects of living in a place like Tasmania. The LGBT community in Tasmania is really, really vibrant and really close knit, and there's a real sense of support, I guess camaraderie in the community, and that's a real source of resilience for people that can impact on health in a positive way as well.
And vibrant in rural areas too.
Definitely.
There's really strong networks.
No, it's really, really good to see. So I guess I in the work that I do, I really try and challenge that idea that being in a rural area and being gay or lesbian or bisexual or transgender is categorically or entirely going to be a bad time. That's really not the case. But we do need to keep fighting for improved access to services and things like that, because there are still issues that people face in those areas.
So I guess the message is, if you're in a rural and regional area and you're feeling alone, do reach out to these groups and through Facebook or through services and see what's out there. And there will be a list of resources and services on our website.